Welcome back to our Bloomberg Focus. I am Mary Berg Godwin, and I have a friend of the show here, Steve Brady. He's back, the CEO of Tempest Therapeutics, joining us today again.
Thank you for having me.
I loved our last chat, so I'm glad to have some more time to drill down and hear what's new with Tempest Therapeutics. First, your ticker symbol TPST, and so you're a clinical stage oncology company,
yes,
Tempest Therapeutics, and I know liver cancer is the primary type of cancer that this main drug that you're focusing on. So TPST 1120 now has a new name.
Yes, it does. Amezalpat.
I was going to try to say it, but I'm glad you said it first. Amezalpat.
Should be easier to say than a lot of the names out there.
Amezalpat. Amazing Amezalpat is what we're going to call it. Okay. So last time I believe I spoke with you, we were in phase 2, or you were in phase 2. And so where are we now and what's been going on?
Right, so technically we're still in phase 2 because even though we released the data that were received really well, as a reminder, we did what you consider a gold standard, right? A randomized study. We took our drug, combined it with the standard of care, and we compared it to the standard of care. And the reason everyone was so excited was because it beat it soundly in every category and didn't add much toxicity at all, which is, again, is always one of the goals, right?
Yes.
If you want to move the needle for cancer patients, you want them to live longer and actually have a quality of life. So adding on a whole bunch of toxicity doesn't make sense. So that's the phase 2 portion of the development of Amezalpat in liver cancer, because you made an important point. That's the focus, but that's not the only place this drug could go. So where we are now, and this is very important in drug development, so we took those data and we went to the FDA. Which
is a scary thing to do, right?
Absolutely. Absolutely.
That's like the, oh my gosh, what's going to happen?
It is, because you get together and with a whole bunch of people who have done this for many years, have developed, tried to develop multiple drugs, or been successful in some cases, and you think, I'm going to go forward with something. This makes a ton of sense. I think the FDA will agree with me, and I think the Europeans will agree with me, and I think the Japanese, because remember, this is global.
Right.
We have to take what we're doing with the FDA and go around the whole world with this. But the FDA is your big initial mountain to climb. And I have to say, just to be fair to them, because the government always gets a lot of grief, I worked in oncology most of my career. The oncology division of the FDA have been great overall, because we have the same goal, right? We're trying to get drugs to patients that balance benefit and risk, right?
Yes.
So we went to them with a proposal, and it was scary, and it was a wonderful set of conversations, very constructive. Granted, we didn't go in with anything crazy. We went in with what you call the gold standard of getting a drug approved, which is overall survival. That's going to be our endpoint. We went in with saying, hey, we're going to take this, add it on to standard of care and compare it to standard of care, basically taking our phase 2 and enlarging it, making it bigger so you can get all the math, right? You need statistical significance to win. That is one of the most rational ways to develop a drug. We didn't ask for shortcuts. The only thing we asked for could end up shortening things significantly in a phase 3 is we said, look, if this does really well, and we hit what you could call early efficacy, that is where we look earlier than the end, and you say this is working, can we end earlier? Can we file to get drug approval? And they agreed.
This might be way too in the weeds, but how long does that take, that process of you present it to the FDA and like an actual presentation in a boardroom or something, and then they think about it and assess the information? How long does that take? Absolutely.
So it's funny because I don't get that question very often. It's a process that takes months. We put together what's called a briefing. We ask for a meeting. They say yes or no. They can say no. They can say do Zoom.
They can? Wow.
Yeah, and they could say, let's just we don't need an in-person meeting. We can do this, or let's do Zoom. They actually said, feel free to come to the East Coast. We'll meet in person. We submitted then what's called a briefing document, which is, in our case, was close to a 100-page document with all of our arguments. This is why we think this is good for patients. This is why we hope you agree with us. And our initial reaction back from them was, largely, we agree with everything. Great. There's a few more things we want to talk about. We said, okay, we flipped it into a Zoom meeting because we said, we're not going to fly to the East Coast if we're and then the last meeting was great. And then they give you what are called minutes. And that's what you live by, your meeting minutes. And it's another big document that says, these are the things we discussed.
I mean, I don't know why that's fascinating to me, but I just, the process of getting it, because it's rigorous, and it's rigorous,
and they're being careful. Yeah, they're being careful, and they should be. Their job is not to let things get out into the market and get to patients that weren't carefully thought through. And we should want them to do that.
Right. And then it probably makes you think about things you didn't think about before.
Absolutely.
With just under 1 million deaths a year globally, the threat of liver cancer creeps up on us every day. A disease that thrives off obesity and alcohol consumption, finding itself a home in a society made of fast food and alcohol ads. It's causing a storm that together we must be prepared for. However, it's not just the disease we need to be wary about. The cure can be just as sinister and brutal. What about the quality of the patient's life too? How much suffering is extra time worth? Join us as we find out, what is this disease? How are we treating it now? And most importantly, who is doing something to make it better?
I think obviously we need to improve the survival, but we also need to improve quality of life.
Tell your immune system to be able to identify the cells that it should have been killing.
This is the story of your liver's fight for survival. Liver cancer. It's a silent storm, often building unnoticed until it strikes. In part 1 of this series, we explored the growing threat, how this disease has become more prevalent, and why the numbers continue to rise.
So, I think it's really driven by more obesity and more alcohol. It takes a long time to get liver cancer. We're just starting to see a spike in liver cancer from the Great Recession, like 2007. So you can imagine people started drinking more during the pandemic. I can't even imagine what my clinic is going to look like in 10 years.
Many Americans apparently drinking their way through quarantine. It's easy to chuckle about that, but it's not funny.
We looked at the science, the risks, and the harsh reality of what liver cancer does to the body.
Each year, there are almost 1 million new patients diagnosed with liver cancer. And prognosis isn't great. The reason why is because people usually show up to the doctor's office and they already have pretty advanced disease. The overall survival rate is low. So the 5-year survival rate is less than 20%, which means then less than 20% of people who get liver cancer are going to live beyond 5 years.
Worldwide, there's more than 700,000 people that die per year. And in the United States, liver cancer ranks among the top 10 killers, both in men and in women, although we know that men are more commonly affected than women. Roughly a little bit less than 50,000 people die in the United States every year from liver cancer.
For every number you hear in a statistic, there is a person behind the number. A mother, father, son, daughter, a neighbor, a friend. If the survival rate wasn't enough of a concern, the path to recovery from the disease is just as arduous. The cost of health for a patient is often very high and painful. Our team set out across the country to find individuals who have faced this battle, to learn more from their stories, so we can get a clearer picture of what this dark cloud society faces actually looks like. These stories will guide us along our path as we run into the unlikely heroes at the forefront of this fight and help lead us to the possible solutions on the horizon.
My mother just got diagnosed with HCC. She has numerous tumors. The largest is 1.8 centimeters in her liver. The doc said chemo is the option as the tumors are close to the portal vein. I don't know if chemo will be helpful. My mother's feeling so much pain in her right side of the abdomen, I can't see her in the shape.
I just found out my dad was diagnosed with HCC. The tumor is 7.5 centimeters, and there are multiple smaller mets inside his liver. I don't know what it all means. His first appointment is tomorrow at the cancer center, but his scans were done on May 2nd, so I'm worried it'll spread more. They're doing a chest CT too. I just found out yesterday. My head's spinning.
I went outside and just stood outside under the moon and just looked up at the stars and in the heaven and wondered how much more I could tolerate. Wondering how far I was going to get and feeling like this might be the end and really feeling not sorry for myself, but sorry for my family and then also sorry for all my students that I was still in relationship with, my community at large. So that night under the stars, I did just lay down in the field in my bathrobe, cried really hard and said goodbye to the world.
These are the patients.
My name's Karen Hoyt, and I was diagnosed with hepatocellular carcinoma in June of 2014. In 2010, I was diagnosed with a liver failure. I had an emergency room situation where I was cycling one day, and the next day my liver failed, and I turned yellow and blew up overnight. Liver disease can be a silent killer, and we had no idea that my liver was failing until my organs began to shut down. So I had to have blood transfusions. It was just an enormous mass rush to save my life. And it was a pretty cruel blow to find out that then, even after I got stabilized, I would have to continue to be surveillanced or continue to be monitored for the rest of my life for liver cancer.
Cancer is very impactful on people's lives. We were talking earlier about the fact that there's nobody who hasn't been impacted in their life by cancer, whether it be a family member, a loved one, a friend. It touches everybody. It's a very frightening disease that in general people don't understand. They don't know really what cancer is, and it's because it's super complicated. Cancer is not one disease, it's a multitude of different diseases that are biologically distinct. Anybody can get it. Doctors get cancer, healthy people get cancer, unhealthy people get cancer. It strikes everybody.
So I had surveillance done every 6 months, just like my doctor ordered. I stayed in compliance with everything they asked me to do, and that included getting an alpha-fetoprotein marker, which is just for the type of cancer that I got. And I also had ultrasounds done every 6 months. And during one of my visits, a routine visit, my liver had popped a tumor.
Hi, my name is Jason Crutchley. I was diagnosed at birth with atrial septal defect, transposition of the great vessels, subaortic stenosis, and pulmonary atresia. Basically, I was born with one chamber of my heart instead of four. I had the Fontan procedure. One of the downfalls of the Fontan is the increased pressures throughout the body. Those increased pressures gave me cirrhosis of the liver and also gave me hepatocellular carcinoma.
About 80% of these cancers arise in the context of underlying liver disease and chronic inflammation, which makes it way more difficult because you actually have a cancer that arises in an already diseased organ.
I was actually being worked up for a transplant in 2017, and in 2018, I had gotten up in the middle of the night. I couldn't sleep, had insomnia, decided, I'll read through my medical chart just to see what the doctors had written, kind of curious, and so I'm reading through it, and I saw a few things, and all of a sudden I'm reading hepatocellular carcinoma, and I went, wait, what? I know what carcinoma is. What is hepatocellular carcinoma? And it was 3 o'clock in the morning. It was in November, if I recall, of 2018, and I'm like freaking out. What is this? And so the next morning they called me up and said, oh, you didn't know?
My name is Florinda Gray Davis, and I was diagnosed with end-stage liver disease in April of 2017. I was diagnosed with inoperable liver cancer in August of 2017.
Cancers like to hide from the immune system. The immune system is constantly trying to fight cancer. Cancer is always hiding from the immune system. And one of the ways that the cancer hides from the immune system is it puts up these blocks on the immune system. The most important molecule that has been identified to date is PD-L1. PD-L1 on a cancer cell binds to PD-1 on a T cell. That's the immune cell that attacks the cancer. And it's basically a don't attack me signal. So it actually turns off the immune system.
I was running a high fever. 104 for an adult is not a good thing. And I remember being thrown back on the bed, doctors around me, really don't remember much, but I woke up in ICU. And this doctor comes in and he says, Miss Gray Davis, you have inoperable liver cancer and you need a liver transplant or you're gonna die. And turns around and walks out. And I look at my aunt and I'm like, what did he say? I said, what did he say? Go get him. And so she goes and gets the doctor, and the doctor comes back in, and I said, "What did you say?" And he said, "You have inoperable liver cancer, and you're going to die if you don't get a liver transplant." That was it. And
Steve Jobs said, knowing you're going to die changes everything. If you know you have a limited time, you want to make it meaningful. Mitch Albom from Tuesdays with Maury said, when you learn that you're going to die, you start living differently. But it was Seneca who said it best. Sometimes, even to live is an act of courage.
Big Biz Show continuing wherever you're watching, wherever you're listening. We always appreciate you being along for this wonderful ride. We always appreciate them being with us in studio. Of course, that is the world famous day trader Quattro, best in the business. Back here at the bar, it is Costa, it is Mary Burt Godwin, and it is Sully.
You know what's funny?
What is funny?
The entire building was cracking up. We were talking about the all caps thing for me.
Yeah.
This whole time you thought I was doing all caps. You guys all thought it was just like, okay, it's totally. The controller says, yes. You've never explained that. I realize the entire world thinks I'm like, so Mike.
Yeah. It's like Mary.
And everyone will be there. James will be there. Jared will be there. Mark will be there.
Mark.
I can only imagine all of these years. It's because, and I have Chris Castillo. Hey, Chris, I need someone to go through. Have you looked at your phone book lately? In your phone?
Oh my God.
Your phone book.
The phone book.
The contacts.
Your contacts.
Yeah. Oh, your phone book?
Yeah, what?
1980
You also just dated yourself, but yes.
Okay, fired.
Roll it.
Trace! Fired.
Is it next to your Trapper notebook keeper?
Yes. No, it's next to my day timer. And
let me go through my Rolodex.
And my garage door opener, aka my pager.
My pager.
Nice.
I've got 4,100 contacts.
Oh my God!
And 2,100 are duplicates.
Exactly.
This is why we need James McCormick.
We do.
Because he can disrupt this entire
He is the CEO of Cloudastructure Incorporated, their ticker symbol CSAI. Great to have Mr. McCormick back with us here.
James?
No, James. When I put James in my phone, I put it in lowercase and uppercase.
Okay.
And James and I text frequently, and we're very, very clear. You know what we never talked about is your project management solution of the year thing that came out when you were on last time.
Prop tech.
Yeah, what is that? What is that?
Yeah, it's an award looking for innovation in technology, and the mobile surveillance trailer that we've talked about in the past that we introduced earlier this year called Alpha, it won the Prop Tech Breakthrough Award for the Project Management Solution of the Year.
Wow.
Specifically targeted at the construction market, at least initially. So, yeah, very exciting.
Well, congratulations. I mean, that's
amazing.
Well, can you describe Alpha at a glance for us?
Sure. Mobile security trailers. So think of an environment where you want to have protection of materials, tools. You don't want people squatting on a partially built building, but you don't have the infrastructure to support our solution, which is fixed cameras and speakers and those sorts of things. So you roll one of these trailers in, which basically has a number of configurations to it. Could have a generator, they all run on solar power, and then there's a telescopic mast that has all of the items that allow us to do what our system does. Cameras, speakers, strobe light, those sorts of things.
Hey,
so
James,
it's a pretty clever solution.
Well, it just goes with disrupting that $20 billion physical security market that we talked about.
Yep.
For those folks who haven't seen you before, I want to talk about CloudStrike, and by the way, ticker symbol CSAI. You guys, record Q2 growth. You got 267% revenue increase.
Wow.
You got $3 million in new contracts. Boy, the future's pretty bright here, pal.
So that's the device that gets rolled on to a lot of some sort. And wow.
Yep, that's it.
And the idea is, once again, you said this before, this is not reactive.
Correct.
It's meaning that Somebody breaks in, alarm goes off, cops are rolled.
Yeah, right.
This is well before this. This is predictive. It's predictive almost. Would that be accurate?
Absolutely. Which is where the artificial intelligence comes in. So Sally, here's what I would say. What we're seeing right now in our business is a fundamental shift in the security industry. Every customer that we talk to that doesn't have an upgraded solution is no longer satisfied with a legacy system that simply records events.
Yeah.
They want help preventing incidents before they happen proactively, and that's exactly what we do.
James, is it safe to say that you are that wanted big brother that is literally watching? And as you said, it's not like, okay, we'll send somebody in 15 minutes. Boom, we are on it now.
It's an interesting description. The wanted big brother. Never really thought about it that way.
Well, I'll tell you why that's important. Do you remember the Boston bomber?
Yes,
of course. And remember how they caught him? Remember how they caught him?
Yes.
They caught him with the Big Brother streetcar cams.
Yeah.
Yes, absolutely.
I'm just assuming that had they had this technology back then,
oh my God,
it may almost have been prevented. Versus, you can't guess in hindsight, but in terms of technology, where this is going, for you folks,
absolutely
right? I mean,
absolutely, absolutely correct.
As your mad group of scientists in that downstairs lab over at Cloudastructure, are they constantly sort of feeling, what is the next gen? What's the 2.0?
100%. 110%. Yes, they are. They're constantly thinking about the next solutions, the next evolution of artificial intelligence, the next evolution of how we can make our solution better by refining what we call tags, right? Hey, there's someone in the parking garage. Are they just going to their car? Is that a set of car keys, or is that a crowbar or a Slim Jim that they're using?
Hey, James, when a client, and I know that you're CEO of a public company, but for your sales staff, when a client's on the other end of the table and says, "Hey, we already got cameras in the parking lot," what is your elevator pitch to say? Yeah, but what? How do you describe that? What is that?
Sure.
What is that?
Sure. You already have cameras, but generally stated with a historical system, that's just hooked into some sort of a network video recorder that gets overwritten periodically, and good luck finding the actual footage of something that happened last night, right? What we do is we index those searches, right? We are these events, we make them searchable and executable, much the same way that Google indexed the web. So if there was a car break-in, right? If they wanted to go back and look at it, they could go, car break-in 11 p.m. last night, boom, there's the video.
Whoa.
However, let me just say this. What we have demonstrated for years now, and again through the first 7 months of this year, is a 98% deterrence rate. What does that mean?
Dang.
We capture videos of possible threatening events. If it looks like, based on our algorithms, it's something that needs further intervention, that alert will go to our remote guards who are actually looking at multiple screens at a time. They can look at it and determine, oh my goodness, that is someone trying to break into a car. They can talk them down using our speaker system, saying, this is a secure area, et cetera, you're being monitored. And 98% of the time, they pack up and they leave.
You don't want to do that.
Clearer.
You don't want to do that. Yep, exactly.
The picture is really clear, right?
Come on.
Super clear.
Wow.
Yep.
The company is Cloudastructure Inc. Their ticker symbol is CSAI. Cloudastructure.com is the website. He is the CEO, Mr. James McCormick.
Thanks, buddy.
James, always great to have you on the show. All right, keep it right here. Speaking of the show, there is much more to come right after this. Loft 100 Studios, the Big Biz Show, and our affiliates and our hosts are not registered investment advisors or broker dealers.
Our show hosts make no commitment that the purchase of securities of companies profiled or otherwise mentioned in our programming
are suitable or advisable for any person, or that an investment in such securities will be profitable in general.
Given the nature of the company's profile and the lack of an active trading market for the securities, investing is highly speculative and carries a certain high degree of risk.
We profile selected publicly traded and privately held companies on our program.
Most of these companies that we profile have provided compensation to Loft 100 Studios and its hosts for the profile coverage.
From time to time, we sell shares of the companies profiled in the open market that we receive as compensation for coverage of client companies.
But never sell stocks if we are speaking about interviewing or covering a public company who has paid compensation.
Specific questions on compensation can be obtained by contacting producer@sullyentgroup.com.
Listeners should verify all claims and do their own due diligence before investing in any securities mentioned on this program.
Investing in securities is speculative and carries a high degree of risk.
We encourage our investors to invest carefully and read the investor information available at the websites on the
Securities and Exchange Commission at sec.gov and or the Financial Industry Regulatory Authority, FINRA, at www.finra.org.
I like it.
Hey, is that a rescue plane?
We continue on the Big Biz Show, live from the Loft 100 Studios. As always, appreciate you being along for the ride. That is the world-famous day trader trio. Best in the business, no less than self-taught. Back here at the bar, it's Costa, Merriman, Godwin, and it is Sully.
Good to see you guys. What are we at? 80 million homes now? It's 175 countries and all the ships at sea.
All the emails I get from around the world of people who hate me, it's a lot. It's a lot.
Wait a second, though. But we got that. We got a new list of where we're at. You can find us
pretty much everywhere.
On Spreaker, on Spotify. You can find us on BizTV. You can find us on Bloomberg El Financiero. I mean, Mary redid the thing. You know, the thing and the thing.
The thing. Oh, you remember the thing?
You did the thing.
Yes.
You know that we're on the air somewhere every hour of the day. Because I wake up in the morning.
Yep.
And 4:30, somebody's email. Oh, I loved your interview with Aaron Day. I go, what? And it's like 2 in the morning.
Exactly.
Speaking of Aaron Day.
Aaron Day is the CEO of Amaze, and their ticker symbol is AMZE. And he was so excited to join us. He said, no, I'm not doing Zoom. I'm going to helicopter down from my palatial state in Huntington Beach, California. He is here at the bar with us. Aaron, welcome to the Big Biz Show.
Thanks, guys.
I have to ask, so you guys are in the business of content creators and monetizing content creation online. And we've been hearing about this since 1998 when we first got that Netscape browser. And our America Online, I believe it was called.
The free CD.
And everyone always said content is king. And that's what's going to happen. I don't think anybody really knew what it meant, but you seem to have it figured out. So why don't you give us an overview real quick?
Yeah, so content is king, queen, and everything else you want to call it, right? It is what rules the world today. There's somewhere between 300 to 400 million professional creators, semi-professional creators. People making $50,000 a year or more creating content.
Now, are we confusing creators with so just so we can understand, is that an influencer or is that just are those separate?
Big difference between a creator and an influencer. Okay. A creator is somebody who has a full-time job creating unique content, anything you could think of. It could be a business, a restaurant, a bar, a yoga instructor, who cares, right? They're making content and they're building a community online. Any of the platforms. An influencer already has some followers. An influencer is doing deals with brands and helping promote a third-party brand on social media, right? So,
and they also may be content creators though, because they're the ones coming up with the video content that they're promoting. The brand,
absolutely,
right?
and they wouldn't be worthwhile to a brand unless they had a community that they could attract and promote the product to, right?
Is the internet turning into one big QVC? I mean, is that what it's coming down to?
It feels like it.
If China has its way, yes. Okay.
Yeah. We're one big home shopping channel, right?
Yeah.
That's what it comes down to.
It's the next generation of the home shopping network. It really is. So.
And I remember, go ahead. I was going to say that I remember, it switched from content is king to video is king. Because video is the content.
Well, yeah, because they used to call it vodcast and then podcast. Well, podcast is the same thing now. It's all one.
But that's showing our age a little bit because gaming is king. Like, if you look at the gaming platforms, Twitch, Roblox, Patreon, you got the next generation of people sharing content through gaming platforms, through video platforms, through WhatsApp.
Yeah,
WhatsApp has become a content creation platform, right?
I did not know that.
Yeah, it's everywhere. So anywhere you touch anybody, it's becoming a content play. So.
Talk about what Amaze does, because you guys fit here pretty uniquely here, and it's only getting better.
So, for somebody who doesn't have a lot of experience in social media, what we do basically is we integrate a commerce engine into social platforms. So you guys have a YouTube channel. As soon as you hit 500 subscribers on YouTube, a little red flag pops up and says, would you like to monetize? Our software is then used to allow someone to embed a shopping experience inside of YouTube. So the benefit of that is then, so if I'm creating a video and you have a nice shirt on, you can tag that video during your video, somebody can buy it. It doesn't matter what device, TV, smartphone, whatever. So we created this software in 2021 that allows you to integrate into social media platforms, and then we realized that every media platform was different. Yeah. They're all broken in some way, right? Yeah. And we said, well, let's just create one that is common across all fan bases. So now we have integrations today with TikTok, Twitch, Discord, OnlyFans, YouTube, Adobe, Pixar, all these different platforms. And what it allows is the creator to create a selling experience and the fan to see one experience. And so we become that company that allows for sort of this integrated universal commerce engine. Platforms love us because we keep people on their platform. People view more content, because we don't force them to leave to go to a Shopify store.
I was going to say, so when you click on something to buy it, it's not going to send you to another third-party app. You're going to do it right there in the platform.
In most cases, yes. There's a few times where the integration may not be robust enough where you have to go out to a third party, but anybody who wants to have it that way, anybody who's smart, because they make their money off ad revenue, right? They embed it and the commerce experience happens in the platform.
And you can do Instagram too, huh?
So Instagram, so funny.
Funny you should ask.
Are they putting in the sandbox nicely with you?
In the spring of 2024, for whatever reason, Meta decided that they didn't want to have integrated commerce anymore. So we were integrated purely in Instagram and Facebook, and they decided to change their algorithm so no one's integrated there anymore. So only commerce that happens in Meta today is via some sort of link in, like a link in bio application. So you have to have a link in, so you still don't get that pure experience there. But I think what it's showing you is some of these platforms are 20 years old. Yeah, their technology is a bit older, right? So the newer platforms coming up that you see coming out in the marketplace now are all built from the ground up, integrated.
So this is an infrastructure, is what this play is. Because if you look at, for example, there's a company called Retailigence, and Retailigence keeps live track. You ever go look at a pair of shoes and say, or watch, and there's two in your size. Any sites you go on, there's always two in your size. Because that's all there is in the internet. Because Retailigence do data scraping to find out what the real inventory is, and every retailer is looking at that. And what's interesting about that backbone is that it's proprietary, and many retailers can't do without it. I can see this sort of same thing on the front end here with you guys. If you guys integrating into some of these commerce websites, there's going to be a time when they can't live without you, because this is going to be the new paradigm.
Yes and no. So it's really important. Like, there's this massive psychological movement where the minute I create the first piece of content, I think I can do this for a living. Okay, it's a drug, guys. Excuse my language. It's a drug, right? Yeah. And I start doing it. I get a few followers, 500, 1,000 followers, and I think I'm the next, Mr. Beast, right?
Yeah.
But I can't monetize so they come.
Nobody's looking at it.
Yeah. So they come to us, and even with a small community, we help them make some money.
Gotcha.
They start making some money, and then they use that money to get a little bit better content. And so the ones that are entrepreneurial, nothing's changed, right? If you have a little bit of entrepreneurial spirit, you take that money, you put it back in, you get professional content, and you grow your audience base, right? Or you do research, or you look at data. So you think about us as that first, second monetization experience, and then watch what happens, right? And then when you get really, really big, we're not an agency, right? We help you on your way up, right? And so we are contagious a bit, because once you start making that money, you want to make that money.
Is your model transaction based? Like you get a little chunk of everything, or you take a fee for some of the stuff, or is it one size?
We get a revenue share on everything sold, physical or digital products. So we get a chunk there, nice margin, nice chunk, and we're getting more and more subscription fees, because as these people grow up, and they need tax services, they need financial services, they need marketing services.
Yeah.
They need all these different things. We're embedding more and more of those services in our platform.
Can you say with this, because I want to talk about where AI is going with this. Was crypto coming to this thing? Does digital currency happen? I mean, you guys are really at the tip of the spear for a lot of this stuff, and there's so much more to talk about. The name of the company is Amaze. Aaron Day, CEO, AMZE, the ticker symbol. Website is amaze.co. More with Aaron Day right after this. Big Biz Show rolls on. We are at the Loft 100 Studios. In case you're wondering where we are, I'm wearing glasses because I'm really smart. I'm Mike Costa, Maribert Godwin, Greg Todoroff, and Sully. Look at that. Look at all the smart people.
You know, there's a saying that stocks always return to their mean. And what that means is that, you know, stocks tend to like come back to where they normally are going to go. You know, if they spike up, they typically come down a little bit.
Yes.
I think glasses have come back. You know, glasses were not thought of as so nerdy in the 50s, and now they're actually
trendy.
People are like wearing glasses with just glass in them, not prescriptions.
Right. No prescription.
Oh God.
Just to look cool, like you, Mike.
Do you know who we're going to have on the air very shortly? Is a company called Caddis.
Yes.
Hello.
And, yeah.
Is that what that is?
Yeah. Paul Gomez is a good friend. In fact, Mike has the glass. I don't know if you can get up close to that. But Paul Gomez was one of the guys that ran Quicksilver and Hurley, and was one of the lead investors in Caddis. He's going to come in the studio and talk about sort of how that company started. I have nothing but Caddis eyewear now, and I get, you know, it's so funny. People are starting to buy me reading glasses now for home. I got the pink clear ones now. I got the blue clear ones now.
I need to be on this distribution list.
Well, and let me tell you how good the sunglasses are. The sunglasses are so good that at our last concert, I had to borrow Trace's sunglasses, our drummer, because I've got a little cheat sheet in front of me. It looks like a monitor. It's actually a TV screen that tells me the lyric. Sure. And with Polaroid sunglasses on stage during the day, I couldn't see the damn screen because it took out the blue light or whatever. Yeah. So, and they're not a sponsor, but I was noticing you're wearing them.
They are beefy because I beat the living you-know-what out of my eyeglasses and sunglasses, and these are just substantial.
Yeah.
And because they have a giant freaking head, they don't make my head look giant, so I love it.
Get an endorsement.
Yeah. I'd like to.
I think Mike's pitching an endorsement.
I'd like to get an endorsement.
Do you have a giant head?
You have a giant head.
Is your head the size of a planet? Does it look like an orange on a toothpick?
Looks like Sputnik.
Hey, Dr. Tiago Tres Marques is with us. He, of course, is the CEO of a company called Pasithea Therapeutics. They are publicly traded under the stock symbol KTTA. That's KTTA, on the forefront of research focusing on therapies for diseases of the central nervous system. We never talked about that before. He was on the air with us last week. We had such an overwhelming response via email from our viewers across the country and across the world. I thought I'd bring him right back to you, and I give you, once again, Dr. Marques. Dr. Marques, thanks for coming on the air with us and being so generous with your time. I found out that he has a newborn. How are you saving lives and have a newborn, pal? Wow. I'll tell you.
I have a double job nowadays, right?
Yeah.
I don't have time to look for sunglasses, unfortunately.
Well, we're going to send you some from our new sponsor. Hey, can you talk about one more time for the people that didn't see you last time you were on the air about what NF1 disease is? It's a rare disease. It's got 100,000 patients in the U.S., but talk about what it does.
Yes, of course. It will be a pleasure. Thank you for having me. NF1 is a rare disorder, but it affects 100,000 patients into U.S. It's a genetic disorder. Basically, one of the genes is knockout the NF1 gene, and then you have a number of symptoms that include bone deformities to cognitive problems, and then you develop, the majority of patients develop some sort of tumors arriving from the nerve sheets. Some of these tumors are called plexiform neurofibromas. They rise from the peripheral nerve sheet, they grow, they deform, they cause pain, and they can have a malignant transformation, and approximately 95% of patients have cutaneous neurofibromas. So it's tumors that arise below or onto skin, and they can number thousands. And of course, it impacts the quality of life, the self-esteem. Sometimes they also can cause pain. So these patients are afflicted by a genetic disorder that is rare and curable, but there's treatments, and the treatments are with MEK inhibitors, and we're developing what we consider the best-in-class MEK inhibitor.
Dr. Marques, you talked about MEK inhibitors last time. We never talked about the size of the market for MEK inhibitors. Let's talk about it, because that's a big piece of this here.
It's a big piece. So it's estimated to have peak sales of around $2 to $4 billion annually, not only for the treatment of NF1, because they're also used for the treatment of some sort of cancers. In the NF1 market, there's only one approved MEK. It's selling approximately $300 to $400 million, and it's only recently launched a couple of years ago. Estimated peak sales, $700 million, and only for plexiform neurofibroma that affects 30 to 50% of the patients. If you think that MEK can address also the cutaneous neurofibroma, there's no approved MEK for that indication, then we're talking about double size of the market. So this can be a market that reach multi-billion dollars, and we're developing a drug for the treatment of these two conditions.
Speaking of that drug, it's a novel drug. What differentiates it from currently approved ones?
So a great question. Though there's one approved drug. It has a very short half-life. It needs to be taken twice a day. It has a food effect, meaning that you need to dose this drug in between your meals. You need to fast 1 hour, 2 hours before, 1 hour after, and you give these drugs to kids. So it's very hard to make them compliant with the dosing schedule. Efficacy is not great. Tolerability is a problem. So the drug we're developing, of course, we're on clinical trials still, but we hope that we're going to have better efficacy. We will be able to only dose it once a day, and eventually even less. We're going to try to dose it only once a week, and it can leading to better efficacy and also a better safety profile. So if our drug behaves in clinical trials as it behaves in preclinical in animals drugs, we have a much better drugs, both in terms of safety, efficacy, and tolerability.
Dr. Tiago Reis Marques with us here. He is the Chief Executive Officer of Pasithea Therapeutics.
It's easy for you to say.
Yeah, their symbol KTTA.
So, Doctor, you were just touching on this a little bit about the development. Can you talk about where you are exactly in the clinical phase trial and what you can expect in the next year, 3, 4, 5 years?
And thank you for that question, because you need to test these drugs in people for the drugs to be approved safely and to show efficacy before the FDA gives you to go ahead to market this drug. So we started on phase 1, and we're doing this phase 1 in oncology, in cancer patients, and we're just testing the efficacy, of course, but mostly the safety with dose escalation, giving higher and higher dose to different group of patients. And by the end of this year, we're going to start our trials in NF1. That's the next stage of development. So soon, by the end of this year, we're going to see news on starting the NF1 trial, and we're also going to show some data on our existing cancer trial. So we have a lot of data coming up over the coming years. We have a very thoughtful drug development program, and with the aim to bring this drug as soon as possible to the market.
His name is Dr. Tiago Reis Marques. Of course, the name of the company is Pasithea Therapeutics. KTTA is their stock symbol, KTTA. Dr. Marques, you got to get to San Diego. You and the wife and the little baby, come on.
Bring the newborn in.
Mary, Mike, and Greg will babysit for you while you and I are out at the... Thanks so much for stopping by. That does it for us today. Big Biz Show, bigbizshow.com. Follow us everywhere. See you next time.